Well, I was born in a cottage in Somerset, England, which had no running water. I was born in the early hours of the morning after Christmas in 1924. It was a village which has been in existence, they say, for about 600 years. The houses were all made of stone, and some of them had thatched roofs. So it was a very old community. My headmaster one day called me and said, I have a letter. He said, you want to go to medical school? And I said, yes. And he said, I have a letter I'm going to give you. I want you to take this to the matron, that is the head nurse of St. Bartholomew's Hospital in London. And he didn't tell me what was in the letter. I never knew what was in the letter. I gave the matron the letter. She took off. Then she came back about 20 minutes later and said, Sir Girling Ball will meet you. Sir Girling Ball was the dean of the medical school. So I was taken to his office, which was a typical old office with oak paneling all around the walls and pictures of former physicians at St. Bartholomew's Hospital. So then he asked me if I was interested in sports, and I said, yeah, I used to play rugby football. Oh, he said, I played rugby football. And as a matter of fact, he said, I went to rugby school in the middle of England where the rugby was originally started. And I said, well, that's interesting because I went to rugby school and played against rugby school. I became a medical student at St. Bartholomew's Hospital. And so that was the beginning of my medical education.
I can say truly that Dr. Hardy is the father of modern-day psychiatry. When Dr. Hardy started in 1953, we didn't have many treatments for psychiatrically ill patients. In fact, the first drug known to treat a psychiatrically ill patient, Thorazine, was FDA approved in 1954. So when Dr. Hardy started, the landscape was very different.
Dr. Hardy was the visionary that came to the sanitarium some 62 years ago as a newly trained psychiatrist with the energy and the vision to establish behavioral health as an important service line for Washington Adventist Hospital and Adventist healthcare in general.
He later became chief of staff here, but that wasn't enough for him. He was also chief of staff at Shady Grove Hospital. He was also president of the Montgomery County Medical Society.
"1979 is a big year in my life. I was very, very busy, and at the same time I developed cancer of the colon.
I do believe in God. I also believe in miracles. God, however, does not like to show off, and so most of his miracles, the ones he performs on a daily basis, I think we are blissfully unaware of. Dr. Hardy was a bit of an exception to this because he developed a carcinoma of the rectum. This is invariably fatal. He had a radical groin dissection, he had radiation, he had chemotherapy. In my years of practice, over 30 years, I never saw a patient with carcinoma of the colon that went to the groin and was around to discuss it.
For some 8 years running, and this is probably 30 or 40 years into his service, he was the highest admitting physicians at Washington Adventist Hospital for some 8 consecutive years.
I will continue to respect and praise him and the work that he's done, and continue to be a humble servant to continue the work that he laid and started, the foundation he started for us.
I would like to thank Dr. Hardy for his professionalism to support and promote the vision and the service that are provided by behavioral health for not only Washington Adventist Hospital, but for Adventist healthcare and our community in general.
Cy, it's great to have known you. I feel very proud to be somebody who feels he can call you a friend. Good luck in your retirement. I hope, like me, you'll enjoy it far better than those who know you well suspect you will.